Hello, I'm Dr. Stanley Myers. I'm a urologist in Portland, Oregon, and I specialize in the treatment of men and women's sexual health issues. Today's video is Introduction to Testosterone. Basically, Testosterone 101. We're going to find about what testosterone is, where it comes from, what it does in our bodies, how it interacts with other molecules in our bodies. What are some of the things that happen if you don't have enough? And now for the legal disclaimer. The medical information that you find in my videos and my websites are for educational purposes only. They're not meant to be personal medical advice. That's best obtained from your doctor after a full evaluation. And this is the molecular structure of testosterone. It is derived from cholesterol, that's right, as are many of our hormones in our bodies. 90 to 95% of the testosterone in men's bodies come from their testicles, and about 5 to 10% comes from the adrenal glands that live above the kidneys. Besides testosterone's well-known effect on libido and sexual function, testosterone has a number of other important functions in our bodies, including increasing muscle content in the body and decreasing fat content, increasing bone mineral density and prevention of osteoporosis, increasing body hair production and oil production in the skin. And in the brain, in addition to driving libido, it also may improve a sense of well-being. It may help us think better and remember things better and help improve our mental acuity. So how does low testosterone occur? Well, first of all, you can be born with it. It can be congenital, like Klinefelter syndrome. It also can be acquired, as in when someone has an infection in the testicles, like mumps. In addition, it can be an iatrogenic. That means us surgeons caused it. If someone had testicle cancer on both sides, unfortunately, they have to remove both testicles. Diabetes can also result in worsening testosterone, but by far and away the most common cause of low testosterone I see is aging. This is a graph of the average testosterone level in men throughout their lifespan. In our 20s, we have a peak of testosterone right after puberty, and after the age of 30, we see a decline of about 1 to 2% per year on through later in life. This decline results in a significant drop, especially by the time we get to the 40s and 50s, and the corresponding symptoms start to show up about then. There are some men who do maintain their testosterone levels relatively well over their lifespan, but most men experience a significant decline in their testosterone levels and start having symptoms by the time they're in their 50s. It turns out there's another very important factor on how testosterone works in our bodies. It's called sex hormone binding globulin. Testosterone is a sex hormone, and this stuff binds it very tightly. Once testosterone gets bound to this molecule, it does not let go, and therefore your body doesn't know that testosterone molecule is there. So the more sex hormone binding globulin you have, the less testosterone effect you have in your body. And this is an artist's rendering of how that works that I found on the internet. As you can see, SHBG, or sex hormone binding globulin, locks onto testosterone, and that testosterone is bound. It cannot get into the cell, but only the free testosterone is able to go into cells such as muscle and other organs in our bodies. And this pie chart is showing us how much testosterone is actually free in the body, and it turns out it's about 1 to 2% of our total testosterone that's in our bloodstream is free to go into the cells. The rest is bound by something called the sex hormone binding globulin, which we just talked about, as well as a little more loosely bound to a protein called albumin, which is in our bloodstream. Turns out that it's very difficult to actually measure that free testosterone component, that component that can get into the cells. So we have to calculate it. We can measure total testosterone, we can measure sex hormone binding globulin levels, and we can measure or estimate albumin levels, which don't fluctuate much. So how do we find that calculator? Well, there's some guys on the internet that put this on. If you Google free testosterone calculator, one of the first websites that come up is issam.ch. And this is a free testosterone calculator online where we can enter information that we get from our labs straight into this and hit calculate. So average SHBG should be about 25. Let's say a man has a testosterone of 450, and then we hit calculate. We get a free testosterone number of 10.9 nanograms per deciliter, or 2.4%. Most important number is right here, 10.9 nanograms per deciliter. Anything over 10 I consider normal. But let's say that man had a SHBG for some reason that was higher. Let's say it was 60, 64. We calculate now his free testosterone is way down to 5.9, well below the 10. 450 looks good to most doctors, but if you don't factor in the fact that he's got a high SHBG, if you don't measure it and don't know that, you won't know that his free testosterone is very inadequate. In addition to the decline that men experience as they age in their total testosterone, we see also an increase in sex hormone binding globulin as men age. So if we use our free testosterone calculator, we see that there's an even more steep decline in free testosterone as men age because of the combination of the effects of both. Now, if that wasn't complicated enough already, there's another factor that plays a role in testosterone effects on our body, and that is the testosterone receptor. Testosterone floats around, it goes into the cell and binds to a testosterone receptor within the cell, and it turns out some people have very good testosterone receptors. It takes very little testosterone to make that testosterone work, to have effect on the cells. Other people, their testosterone receptor is terrible. It takes a lot of testosterone to make that testosterone receptor click over and work and have the effects they need to have. In the research lab, we can actually look at the gene that codes for the testosterone receptor and see how good or bad the receptor is. What we're looking for is the number of what we call CAG repeats at the beginning of the gene. The more repeats there are, the worse the receptor is, and the less there are, the better the receptor is. Unfortunately, this is only available in research labs, and we don't have a clinically available test that I can test on my patients to see how good or bad their testosterone receptor is. So this is why some guys with what seems to be a very low testosterone have no clinical symptoms of low testosterone. They do pretty well. We would therefore assume that that man has a very good testosterone receptor. So simply knowing just the total testosterone level is really of little value. We need to know what the free testosterone is, so we measure the SHBG and calculate that. In addition, we need to use the patient's symptoms to guide us. If he's got a low testosterone but he has no symptoms, he wouldn't be someone that I would be interested in treating. So what are the effects of low testosterone? Well, there are sexual side effects. Low libido, difficulty with erections, difficulty achieving an orgasm, or decrease or significant lack of spontaneous morning erections. In addition to the sexual side effects, there's psychological effects, depressed mood or feeling grumpy, decreased motivation or energy, decreased sense of well-being. I just don't feel right. I just feel kind of down into the dumps. Or impaired memory and cognition can also be side effects. Other negative effects of low testosterone would include increased risk of osteoporosis as we age, increased fatigue, loss of muscle mass and body strength, increased body fat content, which further lowers testosterone. There's also evidence of increased risk of heart disease if your testosterone is low, as well as increased risk of diabetes or poor what we call glycemic control, sugar control. And although rare, anemia can be a symptom of someone with significantly low testosterone levels. So what do you do if you think you have low testosterone? Well, you ask your doctor to test you, get a total serum testosterone and an SHBG so we can calculate your free testosterone. In addition, I ask patients to get a PSA because there is evidence in our literature that patients with low testosterone are at an increased risk for prostate cancer. And finally, I ask them to get a complete blood count to make sure they're not anemic and to see where they're starting from, because sometimes testosterone replacement can cause a significant rise in their red blood cell counts. If it turns out that your testosterone was low, we want to retest it just to make sure that it wasn't just a bad day. We'll also add something called luteinizing hormone, or LH, as well as prolactin and thyroid stimulating hormone to make sure those aren't factors causing the low testosterone levels. So you may have some or all of these symptoms. Some patients that have low testosterone have some of them, but not all of these symptoms. Or the symptoms could be due to something completely different and not related to a low testosterone at all. Generally, the next step, if we find that you have the symptoms and the low testosterone, is to give you a trial of testosterone replacement therapy. And we ask patients to commit to 2 to 3 months before they decide if it's making a difference or not. After 2 to 3 months, patients may come to me and say, wow, I feel better than I felt in forever. All these symptoms have gotten better. And in those cases, we know that we need to continue the testosterone treatment. Patients that come back and say, well, maybe I'm a little bit, I can't really tell if it's helped me or not. Those patients probably had symptoms from other causes and not from the low testosterone, and therefore we would stop therapy. And so I have other videos that will address the treatment of testosterone deficiency. In addition, there's other videos that will talk about the risks and benefits, including the risks of testosterone and prostate cancer, as well as cardiovascular risks. So please look for those on my website, www.nwsexualmedicine.com.